Welcome back to our informative series on avoiding erectile dysfunction, specifically tailored for men over 40 who want to take proactive steps toward better sexual health. In this third installment, we'll delve deeper into advanced strategies that build on the foundational advice from previous parts, focusing on practical ways to maintain vitality and prevent ED from impacting your life. Erectile dysfunction, commonly known as ED, affects many men as they age, but the good news is that it's a common concern that's often highly treatable through lifestyle adjustments and medical interventions. And it's certainly not an inevitable consequence of getting older. Among the primary factors that contribute to ED are underlying medical conditions such as diabetes, which impairs blood flow, and heart disease, which affects vascular health. Alongside poor lifestyle choices like smoking that damages blood vessels and obesity that strains the cardiovascular system. In addition to physical causes, psychological issues including chronic stress from work or life pressures and anxiety related to performance can significantly contribute to the onset and persistence of ED, making mental health a critical component of prevention. Today, our main emphasis is on a range of actionable and evidence-based strategies designed to help you proactively avoid ED, expanding upon the essential foundations we covered in the earlier episodes of this series. The first and perhaps most foundational strategy is optimizing your diet, placing a strong emphasis on incorporating heart-healthy foods that support overall circulation and vascular function essential for sexual health. Make it a habit to include an abundance of fresh fruits like berries and citrus, a variety of colorful vegetables such as spinach and broccoli, and nutrient-dense whole grains like oats and quinoa into your daily meals to nourish your body effectively. On the flip side, it's equally important to consciously limit your consumption of processed meats like bacon and sausages, as well as foods high in saturated fats such as fried items and full-fat dairy, since these can harm your cardiovascular health and increase ED risk over time. Moving on, prioritizing your cardiovascular health is paramount, which involves committing to regular aerobic exercise, maintaining a healthy weight through balanced calorie intake, and staying consistent with your fitness routine. Regularly monitoring key health metrics like your blood pressure to keep it below 120/80 and cholesterol levels, aiming for LDL under 100 milligrams per deciliter, is vital for sustaining a robust heart and preventing conditions that lead to ED. Another essential area to address is managing your psychological well-being, as mental health directly influences physical performance. Incorporating effective stress reduction techniques can lead to noticeable improvements in your overall and sexual health. Explore and adopt practices such as daily meditation sessions for 10 to 15 minutes, gentle yoga routines that enhance flexibility and calm, or simply spending quality time in nature like walking through a park to help soothe your mind and reduce tension. If you're dealing with ongoing anxiety or symptoms of depression, don't hesitate to reach out for professional help from a therapist or counselor, as addressing these mental health challenges can directly enhance your sexual function and confidence. Furthermore, engaging in relationship counseling can prove highly beneficial, particularly for tackling intimacy challenges, building emotional connections, and alleviating performance anxiety that often arises in partnerships. It's also important to focus on optimizing your hormone levels, with particular attention to testosterone, which naturally declines with age. But any adjustments or therapies should always be pursued under the careful guidance of a qualified healthcare professional. Your doctor can conduct thorough blood tests to accurately assess your hormone levels and, if deficiencies are found, recommend safe and appropriate interventions such as lifestyle changes or monitored supplementation to restore balance. Ensuring you get between 7 to 9 hours of restorative sleep each night is fundamental not just for daily energy, but also for regulating hormones like testosterone, which are primarily produced during deep sleep cycles. Beyond sleep duration, addressing and treating underlying conditions like sleep apnea through methods such as CPAP therapy can dramatically improve your sleep quality, boost daytime energy levels, and positively impact your sexual health. Incorporating mindful habits into your routine is critical for long-term health. One of the most powerful steps you can take is quitting smoking entirely, as it improves blood flow and reduces the risk of ED within months of cessation. Similarly, moderating your alcohol intake to no more than 1 or 2 drinks per day and steering clear of illicit drugs will safeguard your vascular system and overall well-being, preventing further complications. Don't overlook the benefits of strengthening your pelvic floor muscles through targeted Kegel exercises, which involve contracting and holding the muscles used to stop urination for 5 to 10 seconds repeatedly. Although Kegel exercises are frequently associated with women's health, they are equally advantageous for men, helping to enhance erectile function by improving blood retention and control in the pelvic area. As a final consideration, you might explore a medical intervention such as PDE5 inhibitors like sildenafil, but it's imperative to consult with your doctor first to ensure they're suitable and safe for your specific health profile. When prescribed and used correctly under medical supervision, these medications can be remarkably effective in treating ED, often restoring natural function and confidence in intimate situations. Taking a proactive approach by regularly engaging with healthcare providers, whether your primary doctor or specialized sexual health clinics, is crucial for early diagnosis, personalized treatment plans, and ongoing monitoring. In parallel, fostering open and honest communication with your partner about your concerns and needs is vital, as it can greatly reduce performance anxiety and help cultivate a deeper sense of intimacy and mutual support. By diligently implementing these comprehensive and interconnected strategies, from dietary improvements and exercise to mental health care and medical consultations, you can significantly enhance your sexual health and elevate your overall quality of life as a man over 40. Keep in mind that erectile dysfunction doesn't have to be an unavoidable aspect of aging. With consistent effort and the right proactive approach, you can continue to enjoy a vibrant and fulfilling personal life well into the future. Thank you for tuning in to this third part of our series on avoiding erectile dysfunction. We encourage you to stay informed about your health options and empower yourself to take meaningful charge of your well-being today.